Recording.
All right, how you doing there? Today we're going to do a little head to toe assessment on this baby here. It's a newborn baby, fresh into this life. We're just going to do a little top to bottom assessment on it, make sure everything's all right here. All right, and I'm gonna go ahead and tell you about his blood pressure. His systolic blood pressure is normally range from about 65 to 95, and his diastolic pressure is going to range anywhere from 30 to 60. And when you do that, you want to make sure that you got blood pressure cuffs on both arms and both legs to make sure you got a good choice blood pressure reading. And on your heart rate, it's going to typically range about 110 to 160. And I just listened to his, and my little guy's heart, it's a pumping. He's in 120. We're good. And his respirations are going to typically range from about 30 to 60. And I've counted his for a full minute. He's in there, 45. Choice, that's where you want your baby to be. And on his temperature, it normally ranges from anywhere from 97.7 to 98.6. And you can check it in many ways. One would be to go axillary under the armpit. And I know that some nurses will go through the rectum to make sure it's patent as well. And here we go, we're going to go checking for polydactyly. We're going to see if my man here has got any extra fingers. Extra fingers, no. 5 alive, he's good. 5 toes, well, he's all good there.
5 toes or 10 toes?
10 toes.
Okay.
10 toes, 5 on each foot.
All right, just clarifying. Thank you.
All right, and syndactyly is going to look for a little webbing. We're good. He'd be a real good swimmer if he did have the webbing now. That's good. Simian crease. We're going to be looking for a deep, straight crease in his palm. He doesn't have it. And usually in mental retardations, you're going to see a heavy simian crease in a straight line. But our baby's good. He doesn't. And again, we're going to rate the APGAR score. And let me tell you what that does. It's going to tell you a little bit about his heart rate, his respiration, his muscle tone, his color. And his color, yeah, okay. And when you want to monitor 7 or above, we're just going to keep an eye on him, make sure everything's all right. 6 to 4, ooh, that's not good. We might want to do a little stimulation, rub that back, rub them feet, get him going. 3 to 4, be 3 or less, ooh, we're in trouble. Let's get here. Bring him back for resuscitation. Acrocyanosis is blowing of the hands or feet. It's not a real good measure of circulation because it just came out. You're going to have some blowing in there as long as the color of the rest of the body looks good. And then we're going to look at his anterior fontanelles. It's typically a diamond shape and it closes anywhere from 12 to 18 months. And then we're going to move to the back and look at his posterior fontanelle.
Posterior.
And it's more of a triangle shape. And it closes anywhere from around the 2nd month. And if you see a sunken fontanelle here, which I don't see, we're good, it would represent dehydration. And a bulging fontanelle, it would represent hydrocephalus. And what you'd want to do in a situation like that, you'd want to put him in a semi-pallid position to make sure that fluids was draining. Next, we're going to look for stork bites. What are stork bites? What are pink patches that appear on the face, and they gradually fade away. So if we do have any stork bites, there's nothing to worry about. They'll fade. And a strawberry hematomyelium, they're dilated capillaries, but it's harmless, and they disappear without treatment. We're good. He doesn't have it. And a port wine stain. You might ask me, what's a port wine stain? It's a flat red purple lesion, and here's the thing about it though, it doesn't blanch. So if you look and you see it, and you push down on it and didn't blanch, port wine stain. We're good here. He doesn't have it. Mongolian spots. They're dark blue-gray on the lower back, and they're usually visible in the darker skinned babies. And we'd want to go ahead and put this in the chart so later nobody could suspect abuse. Yeah, so we want to go ahead and put that in there because you'd see it, and that might be alarming to some. And then the Harley Quinn sign. Well, it's going to roll this baby on over on the side, and we're going to look for a deep color over upper half of the body. And changing position helps. You want to check on both, see where it's at. And vernix. That's a cheesy-like substance that protects the skin. And as soon as he comes out the womb, we're going to dry him off. Get all that off there. And milia. Milia are little white pimples on the face, and we're going to inform the parent that it's okay, it'll gradually fade away. Don't pop them. Not good. And Epstein pearls. Epstein pearls are pearly white papules in the upper palate. And when I'm in here looking, we want to check to make sure that we don't have any cleft palate, no cleft lip. Everything's good there. Witch's milk. It's a milk secreted from the neonate. It's normal and it's a palpable mass of 5 millimeters or more. And then we're going to move down to the umbilical cord. We're going to make sure everything's good here. Make sure that we got 2 arteries, 1 vein, Ava. The 2 arteries carry blood away and 1 vein returns the blood. And Wharton's jelly, it's going to cushion the cord and keep the 3 cords separate, and it allows for movement and stretching. And while we're here, we're going to look for, going to show some signs of respiratory distress. We're going to make sure we've got no cyanosis, no flaring of the nostrils, no chest retractions, grunting on exhalation, or increase or decrease in the heart rate or respiration rate. And kaput succedaneum. Kaput succedaneum. It's a swelling of the soft tissue of the scalp, and it does cross the suture line. And the cephalohematoma, it protrudes beneath the scalp, so that's something you'd see upon seeing it. You'd see it. It's out there. And we're going to move on to molding. What molding does, it allows.
Does the cephalohematoma cross the line?
No, it doesn't.
Okay, just checking.
Okay, thank you.
Okay.
Molding. So we're going to move on to molding. What molding does, it allows the fetal head to squeeze on through the birth canal to make sure that everything just kind of compresses, but it doesn't hurt it, and to make sure we just get a good smooth pass through. And then now we're going to do a couple of reflexes. We're going to check here. We're going to make sure he's got his gag reflex, so we're going to stick our finger to the back of the mouth, and the baby should cough as anybody would with a finger in the back of the mouth. And then now we're going to do the suck. Once we put our finger in there, just put it in there, and we want to make sure the baby's starting to suck, you know, that he's got that understanding of what he needs to do. And then our more reflex. We're going to walk in. Hi! The baby's startled. Okay? That's good. He should fan out. Hi! And come right back in. And then the big Babinski, we're going to stroke. We're going to stroke the side of the big toe, and he should dorsiflex. Whoo, that tickles. Hi. And then tonic neck. The head's going to turn to the right. He's going to shrink up like he's fencing, you know. And then the rooting. We're going to touch a little side of his cheek here. And once we do that, he's going to want to turn. He's going to want to turn. He's like, where's the milk? And he's going to want to turn and get on it. All right. And then hip clicks. Once we get in here, we're going to check it. What a hip click is you